Hi, I'm Steve Adubato. We are pleased to be broadcasting remotely from our home in Montclair, New Jersey. These programs will hopefully be relevant for a long time after we're recording, which is on the 8th of April. It is not our job to report the news, to cover the news of this pandemic. Check out NJTV News, check out Metro Focus every night for that and other digital sources and other news sources out there. But we're pleased to be joined by our good friend, Dr. Steve Margeotes, who's the executive director of Main Street Counseling. Good to talk to you, Steve.
Same here, Steve. Thanks for having me.
You guys are a nonprofit. I want to clarify that first, correct?
Yes.
Just like us, trying to figure out how to make ends meet. Yeah. Steve, let me ask you this. The mental health issues, depression, anxiety, other issues, to what degree are they exacerbated in a pandemic like this? Right now, as we're taping, but also we're talking about long-term. Go ahead, please.
Well, two things, Steve. We're overwhelmed right now. Existing clients are asking for sessions twice a week, 3 times a week. We're running all sessions via video or phone. New clients are calling daily. We're probably averaging about 10 calls a day. The anxiety, you're right. The depression, addiction issues, everything has escalated because of the crisis, because you've lost a great sense of control and a great sense of choice. A lot of choices have been taken away from you. Your lifestyle has had to change. I think long-term, you're going to feel the effects of trauma. You're going to feel people hedging when it comes to simple things like a handshake, a hug, meetings. Anybody sneezes or coughs, there's going to be that fear. Do you still have symptoms? So you're going to see even more distancing in interactions than you've seen presently with respect to, we've always talked about this isolation now because of computers,
sure,
cell phones. But you're going to see more of it, I believe.
You do?
I do.
By the way, I know our great production team, Brian Brodeur at East Main Media, they're going to try to, as I'm listening right now, there is a little bit of a buzz. Hopefully it'll be taken out. If it's not, I want to let folks know watching right now. That's part of what happens when you're broadcasting remotely. There are some technical issues, and there are things that are way more important than that. So let me ask you this, Steve. When we talk about isolation, we talk about social distancing. Again, we don't want to get ahead of whatever the government decides to do. We're taping in April. Is it more clear than ever how important mental health, behavioral health is in a situation like this? A, and B, how do we long-term remember what this has been like when we get through it, so that we do not minimize the importance of mental and behavioral health moving forward? We're done with that.
Right. I think it's important to come up with a game plan now that you are in isolation. What the experts are saying, I concur with. You have to have a schedule. You have to stay in contact with other people. You have to exercise. I think the more you can be your own leader and create a plan, so you're not just alone with your thoughts and dealing with that fear. This is a legitimate crisis. I think at the same time, you're right. Long term, you cannot forget the coping skills that you've come up with now when this passes, whenever that is. But I think it's really important to come up with a plan now to deal with this. In some ways, Steve, you have to embrace this crisis.
Embrace it?
Embrace it in terms of you can't run from it. You can't put the covers over your head. How do we deal with it? How do we keep going on? How can we function as normally as possible, despite the fact that you're surrounded by warning signs and fear and restrictions, and yet at the same time, you can't hide. And I think that's important.
Let's follow up on this. Again, if you're just listening right now or checking in, we're taping remotely, recording remotely from our home in Montclair. Steve Margeotes is with his team. You're at your office right now?
I'm at my office in West Orange.
Okay. And again, we're talking a lot about remote counseling, mental and behavioral health done in a fashion that's not so face-to-face. So here's my question. For teenagers, we have 2 teenagers. There are parents of teenagers listening right now. There are teenagers who we want to believe actually watch public broadcasting. My wife and I often talk about the longer term implications for teenagers with a crisis like this, with a pandemic like this. Do we understand, like, this will be in many ways, hopefully, the most significant and difficult and challenging part of their lives so far and moving forward, but we don't know that. There's a question here, I promise. How do we help them moving forward?
I think we help them by acknowledging the situation with all its limitations. Okay, this is real and we're adjusting, but at the same time, how do we stay in contact with friends, with family, in any which way possible? I think that's really important, to acknowledge the legitimacy of the problems and how it makes limitations on you. And then how do you go from there?
I like how you said be a leader. One more quick moment on this. You said be a leader of yourself.
Yes.
Translate that again.
I think it's important, Steve, to take charge as much as you possibly can. That could be wearing a mask. That could be taking a walk. That could be actively talking to people via whatever, Skyping, emails, texts, in person. But I think the most important thing is feelings don't lie, and talking always helps. So how can
I'm sorry, go ahead.
Go ahead.
Again, as part of it, my interrupting is bad enough in the studio. It's even worse via Zoom. Go ahead.
You're fine. Well, I think it's important to, you're hearing a lot of no. Okay, you can't do this, you can't do that. What can you say yes to responsibly that enables you to have somewhat a normal sense of the schedule in life? And it's a real challenge, but you can't hide from this. You know, we have to take precautions, that's real. And yet at the same time, what can we do? I think a good one is that, you know, you can take a walk outside. And I think hearing everything, it's almost like you're not allowed to be outside the house. So you have to differentiate what advice and what expertise is helpful and what's harmful.
And to that end, by the way, we're taping, as I said, on April the 8th. The Chiron will be up there telling you that. But hopefully in May, June, July, when this program is seen later, you will be able to walk. And without being overly dramatic here, we'll appreciate that walk in the neighborhood. We'll appreciate that bike ride. We'll appreciate being with friends and family face-to-face in person more than ever. Steve Margeotes of Main Street Counseling, a not-for-profit, making a huge difference every day. Thank you, Doctor. We'll talk soon.
Thanks, Steve. Always a pleasure.
You got it. I'm Steve Adubato. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by RWJ Barnabas Health, the Healthcare Foundation of New Jersey, the Russell Berry Foundation, the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, New Jersey Board of Public Utilities, Clean Energy Program, NJM Insurance Group, Investors Bank, and by the New Jersey Economic Development Authority. Promotional support provided by the New Jersey Business and Industry Association and by New Jersey Globe. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.